Hello and welcome to this session on transforming the food system for nutrition while progressing on the unfinished agenda of nutrition-specific actions. My name is Saul Morris. I'm the Director of Program Services at the Global Alliance for Improved Nutrition, and it's my great pleasure to be the moderator for this session. During this session, we'll be spotlighting two very different approaches to improving nutrition outcomes and asking how we can identify and resolve any tensions that there may be between them. This is particularly relevant as nutrition is at the moment, as in so many sectors, under extraordinary stress and with resources very, very stretched. So we need to be clear what it is that is a priority for us as a community to get done over the next couple of years. 2021 is a really important year for nutrition. There are two big international conferences, and it's critical that we don't go into this historical period disunited. So this is our chance to discuss one of the key topics that will be in front of us during the course of this year. We have a wonderful panel. Each of them have been struggling with these issues in their own way from their own particular specialism over many, many years. Briefly, we have Francesco Branca, the Director of the Department of Nutrition and Food Safety at the World Health Organization, Sufia Askari, who's Director of Child Health and Development at the Children's Investment Fund Foundation, Howdy Buis, the founder of Harvest Plus and winner of the World Food Prize, Rahul Rawat, Senior Program Officer at the Bill and Melinda Gates Foundation, and Panima Menon, Senior Research Fellow at the International Food Policy Research Institute. The format for this session is the following. Each of our speakers will first give a brief presentation, sharing their thoughts on a particular aspect of this debate, which they've been asked to focus in on. They'll have 5 minutes to do that. And I will be evil and nasty with them when those 5 minutes are up and persuade them to yield their place in the speaker list. After they've all finished, we will go into a panel discussion. We have some prepared questions, which will be challenging each of them with to offer a few more thoughts, again, from their particular perspective. And we will do everything possible to keep the last 30 minutes for questions from the audience. So my colleague Lynette Neufeld is busy watching your questions. Please add those to the relevant part of the connected website. And if you could identify which speaker you're most interested in having answer your question, that will help us greatly when we come to prioritize them and direct them to the relevant person. From previous experience, it won't be possible to get to all of the questions, but we'll do our best to cover as many of them as possible. And so without further ado, let's go into the first short talk. Francesco.
Thank you very much, Saul, and good morning, good afternoon to all. Let me first of all thank you, the Micronutrient Forum, for convening this discussion. And yeah, I mean, this agenda really spans across multiple sectors. So let me tell you, in health, we have the unfinished agenda of the coverage of micronutrient supplements. And the response there is that we need to mainstream micronutrient interventions in primary health care and make it a component of universal health coverage. There are major inequalities in access, and quality coverage is also an issue. One of the striking examples is that of iron and folic acid supplementation. While antenatal care coverage has improved and aligned to the new recommendation of 8 contacts, the provision of iron and folic acid supplement does not reach the same level. We estimate that no more than 1 in 3 women has access to this intervention. Why is that so? We need to understand that, and we need to modify the approach with suitable operational research. We also need to seek alternative delivery platforms and consider, for example, schools and the community for weekly iron and folic acid supplements. But we also have fascinating development in the science, about supplementation. And I'm pleased to say that WHO has taken the approach of continuously updating guidelines using what we call a living guideline approach. And for areas such as the multiple micronutrient supplements for prenatal care, that is certainly an area which is of interest, and I know it's very much debated in this micronutrient forum. But then in food systems, we also have an unfinished agenda on food fortification. We need to have the appropriate choice of the vehicles and the fortificants. We need to reach the vulnerable, and not only people living in cities with easier access to markets. We need to make sure that the elements with the best bioavailability are used and the fortification levels are adequate in relation to the characteristics of the vehicle. WHO has now completed the development of guidelines for the fortification of maize flour, rice, and is about to complete the update of the recommendation of wheat flour. Condiments will come next. We will need to work more with national regulators to ensure that the effective science-based solutions are promptly taken up. Fortification needs to be considered a double duty actions with benefits on all forms of malnutrition. While salt iodization still is the main form of coping with iodine deficiency disorders, we need to reduce sodium consumption and adjust iodization levels accordingly. Double fortified salt is now a promising intervention to address iron intakes. How can that be optimized? Similarly, how do we assess sugar as a vehicle in the context of policies that aim to reduce free sugars and prevent obesity? We need to have comprehensive national strategies based on a comprehensive assessment of micronutrient needs and on a detailed understanding of the dynamics of local food systems. We need to consider the benefit of multiple entry points for micronutrients and avoid the risk of uneven exposure. And finally, we need to have better data to monitor the quality and the impact of fortification policies. And again, in food systems, we need to reshape the food environment for young children. Young children eat poor diets. 59% of the children worldwide are not being fed nutrients from animal source food, and fewer than 1 in 3 children eat food from the minimum number for food groups. WHO is updating complementary feeding recommendation with the purpose to look at the prevention of both undernutrition and later risk of overweight and non-communicable diseases. Continued breastfeeding, preventing the use of sugary drinks and sugar-rich foods will be among the priorities. And last but not least, social protection. We need to expand social protection programs to reach the most vulnerable with healthier food through the procurement of fresh, healthier products and fortified foods as needed. We do have a good aligned agenda, great opportunities to implement it with the great political opportunities of next year. Thank you.
Thank you very much indeed, Francesco. Could I now call on Sophia to give us your thoughts?
Thank you very much, Saul. And I'm really pleased to be a part of this conversation. I also believe that this is the right conversation at the right time. I want to kind of highlight 3 key messages, and this is based on our collective learning as a nutrition community. The first is, I think as a community, we need to get better at celebrating success. Between 2000 and 2019, 55 million less kids were stunted. I'm sure we all have been together as a part of the journey when we were like really breaking our heads thinking, how can we reduce the number of kids who are stunted? You know, the problem was complex, multifactorial. However, as we are achieving success and the numbers are coming down, we should learn how to celebrate this success. This is the time that I remember Hans Rosling. You know, he had his own energetic way of showing the numbers and showing the progress and yet energizing us to take things in the positive direction. The second thing, I think as a community, we need to get brave at calling out failures. There are some areas where we have failed, and I think maternal nutrition is one of those areas where we have failed. As long as mothers are lean and thin, you know, they're anemic, they're eating last even when pregnant, I don't think that we can really achieve progress in child nutrition. As long as mothers are really malnourished, we cannot progress much on breastfeeding. Take, for example, the maternal micronutrient supplement. After 20 years of research, we have this product, which is superior than iron and folic acid, yet we don't want to take it to scale. And I think this is a time when I think of, Jim Kim. He said that the world has spent too much in what to deliver and too less in how to deliver, with the result that the it often fails to reach and benefit the people. The third message that I want to give is, through our failures and our success as a community, I think that we have learned and we are ready to improvise. And, food systems and the conversation around food systems being one of those. I do feel that for decades, we talked about nutrition without talking about food and food systems. And I think the fact that we are talking about transformation of the food system is acknowledgement of the problem. We again realize that this problem is complex. You need local data, you need local solutions. But the fact that we are acknowledging it and the intention that we have to act is already progress. I just want to say that this is the right conversation at the right time because of COVID. We all know that food insecurity is rising, child wasting is rising, and the resources are limited, as you said, Saul. So I think this is a time when we should, as a community, think of more integrated programs. We should focus our resources and energy, not just on national, but subnational areas where the burden is. We should deliver programs with an equity and gender-focused lens. We should succeed, we should fail, but we should continue to learn and evolve. Thank you, Saul.
Thank you very much indeed, Sufia. We'll now go to Howdy.
Okay, thanks, Saul. Let me make a few remarks on how food systems can complement direct nutrition interventions. A fundamental cause of widespread mineral and vitamin deficiencies, of course, is that the poor cannot afford to buy sufficient vegetables, fruits, pulses, and animal products. The result is poor dietary quality. As we look to the future, we can break down the specific activities to be undertaken within agriculture into two broad groups. First, those activities which focus on food staples, which must increase the density of minerals and vitamins. Consumers already eat maximum amounts of food staples. Second, those activities which focus on non-staple foods must seek to increase the quantities eaten. Fundamentally, the second strategy is only possible if incomes can be increased and food prices can be lowered. Both broad strategies need to be pursued simultaneously. Food staples are not dense in minerals and vitamins. However, as this slide for the Philippines shows, just for milled rice, food staples do provide significant amounts of a broad range of essential minerals and vitamins, a base, if you will, on which non-staple foods should add. The absolute intake of minerals and vitamins from food staples is the result of multiplying quantities consumed times the density. The first term in this multiplication, quantities consumed of food staples, is a high number. I myself have worked for more than 25 years to promote and implement a strategy of biofortification through plant breeding. This picture shows a deep orange maize developed through conventional plant breeding, which is high in vitamin A. Africans eat white maize, which has no vitamin A, but vitamin A deficiency is widespread. The orange maizes are high yielding and sell for the same price as white maize. Getting Africans to substitute orange maize for white maize in their diets will go a long way toward eliminating vitamin A deficiency at no extra cost to consumers. Use of transgenic techniques, popularly known as GMOs, offer opportunities to multiply the benefits of biofortification. A second strategy for increasing density in food staples is use of fertilizers. Nitrogen fertilizers increase the protein and iron and zinc density of food staples. Also, zinc and iodine may be added to fertilizers and foliar sprays. Lastly, it is important to note that there is a wealth of evidence now in the nutrition literature that increasing the density of vitamin A, iron, and zinc in food staples improves micronutrient status and demonstrates even that functional outcomes are improved, such as less sickness and better cognitive and work performance. Turning now to vegetables, fruits, pulses, animal products, those foods which are already dense in minerals and vitamins. In my opinion, the fundamental strategy should be to increase the supply of specific key foods that can contribute importantly to nutrient intakes, where supply can be increased cost effectively through public policy and investments. There are two fundamental points to make. First, the primary objective is to lower the price of these specific foods. Second, these specific foods will vary greatly by country depending on dietary patterns. I'm a proponent of what I call indirect behavior change, the first column in this diagram. For example, the major push by the Indian government called Operation Flood improved the efficiency of milk production, a highly nutritious and important food in Indian diets. Supply went up sharply and the price went down significantly. Milk consumption increased. Investing in more efficient milk production in India was an incredibly nutrition smart agricultural activity that benefited millions of families throughout India. We need a mix of all approaches, short-run nutrition direct interventions such as supplementation and commercial fortification, and long-run nutrition smart interventions that treat the underlying causes. It is a matter of finding leaders and champions for each individual approach and persevering. We need to bring in more funding under the overall nutrition umbrella. Although they are cost-efficient, sustainable, and resilient, a drawback to agricultural approaches are the long gestation periods. It takes many years, often
Please begin
decades,
to wind up now.
to have large impacts globally. As parents, we invest in our children's education over 20 years. Can policymakers and donors take the same long-run perspective with agriculture? The long-term payoffs are very high. Thank you.
Wonderful. Thank you very much for those thoughts about how we can intervene most effectively through agricultural domains. Rahul, tell us a little bit about your thoughts focusing on the data landscape.
Sure. So good morning, good afternoon, and good evening, everyone. Let me start by stating the obvious. The increased focus on, in recent years, in the food system and the power of the food system and the transformation needed to ensure that all individuals have a safe, affordable, nutritious diet is essential. It's critical that we pay attention to that area. But as someone who sits on a team that primarily makes investments to better deliver nutrition through the health system, I do see a couple of priority areas that need addressing, and I'll mention two. First, I believe that a narrative needs to be built that better demonstrates the way that the food system and the health system can be mutually reinforcing to achieve a common agenda. This, to me, is lacking, or at least the advocacy and communication around it is. The fact is we are operating within a constrained resource environment, and resources are being optimized for a condition or a outcome and not a sector. We have seen some nascent dialogue around this. For example, when considering approaches to addressing vitamin A deficiency in infants and young children, and scenarios under which vitamin A supplementation programs may be modified, acknowledging the heterogeneity in vitamin A intake and dietary patterns within a country. This is an example of continued discussion that needs to happen to think about achieving elimination of vitamin A deficiency. And certainly at the Gates Foundation, we've begun to think about maternal anemia as a condition that multiple teams that have nutrition interests can help address. So the complexity of addressing maternal anemia warrants this tiered approach to improving the overall nutritional status of women of reproductive age, while directly targeting the residual burden of moderate and severe anemia in pregnancy. So there's a role for broad food systems approaches to improve dietary intake of iron, and certainly large-scale food fortification with, for example, double fortified salt has a role to play to improve iron status among women of reproductive age. And this will lead to a reduction in the size of the mildly pregnant anemic population. To further reduce this burden, there's a role for micronutrient supplementation, iron and folic acid, multiple micronutrient supplementation, and this is essential as well. But even when these approaches are successful, there's likely to be a significant residual burden of moderate to severe anemia, and this may require innovative approaches to treating anemia such as parental iron. So I think this idea of this tiered way that the food systems, fortification, and the health systems can be mutually reinforcing is the way to move forward. So the second area that I think needs attention is that I believe an agenda needs to be developed that intensifies a research focus for food system that sort of pivots away from raising the issue salience of the need to transform the system to actually one that identifies what works. We need to go beyond good frameworks and descriptions about how food systems can impact malnutrition in all its forms, and clearly identify an evidence-based priority package. This, to me, the identification of the priority package for nutrition-specific interventions has really helped spur investments by the donor community, and similar efforts are needed for the food system. When you think about the investment framework for nutrition that was published almost 4 years ago, it builds off this priority package and provides a framework for resourcing. And in it, it's interesting to note that while it recognizes that the causes of undernutrition are multifactorial and highlights that improvements can be made through increasing quality, diversity, and affordability of foods, and increasing the control of income by women farmers, ultimately, these interventions weren't included and modeled in the framework because the attributable fraction of the burden that can be addressed by these interventions is unknown. So I think that really needs to be a focus, identifying that priority package. And lastly, I think we need additional analytic tools that can model and optimize cost effectiveness of both food systems and health system interventions for particular outcomes. And we've seen some advancements in that area with the development of the Minimod tool and Optima Nutrition. But frankly, there needs to be much greater uptake of these tools to help influence financing and resourcing for nutrition. Thanks very much.
Thank you very much indeed. And lastly, Purnima, can you share some thoughts with us, particularly focusing on the situation in India?
No small ask. So also, thank you for that. I know we'll come to some questions about India in the Q&A as well, but I wanted to take a moment to sort of lay 3 points out, addressing this kind of debate that you've thrown out at us. So firstly, I think we need some really sharp clarity on how we should think about our goals here. Our goal is to get diverse foods on every human being's plate multiple times a day, all through the year. Literally, we're talking about lifelong actions. This is, in one sense, I find it, it's a simple goal. On the other side of that coin is that it's a terribly difficult goal to achieve. And so if we keep that vision and that goal sort of front and center, and I say that because India finally has one of the nutrition guidelines have been converted into the Canadian plate, my plate kind of guidelines, which in a sense help us to think about what it is we're trying to achieve day in, day out for every single human being, with some special layered in things for the vulnerable populations. The second question to me is really, well, what affects what goes on that plate and what happens every day in the diets of people? And do we know enough about that? This is where the systems that we are talking about today, the issues of the, what role does the food system play? Obviously a lot. But what role also do actions in health systems and in the context of countries like India, where you have a range of food-based social safety net programs, what roles do they play? And then last but not least, of course, we have to recognize that because the majority of people, and I think there's even data on this from countries like India, the bulk of food that is consumed is purchased in the private market. And so what happens in economies and affects people's ability to engage with markets is going to be really, really salient in terms of understanding what goes on their plates. Around each of these, there's been quite a lot of work in India to kind of understand what actions in these different spaces, sort of food system, the health system, social safety nets, etc., what they are doing in terms of what comes onto the plates for people. But I think where we are right now in the context of India is, recognizing, of course, that the challenges around nutrition are both undernutrition and overweight, obesity, and NCDs, and that therefore one has to think together about, what kinds of actions need to happen. In some sense, the beauty of whether you're working on undernutrition, micronutrient deficiencies, or NCDs is that vision of the plate, the healthy plate or the meals that you want people to eat, that doesn't actually quite change so dramatically. And in a sense, I think for us, that can be a unifying force. What is less clear right now, and there's been some research on it, but not a lot, is what's apparent to me as sort of a researcher and a policy observer, if you will, sitting in a country like India, is that around each of these areas, how do you bring more nutrition into actions in the health system? How do you make social safety nets more nutrition sensitive so that what they deliver brings more nutrition in? How do you tackle some issues around the food system, whether it's fortification, whether it's in biofortification, agriculture, diversification of production, or food prices, is that the clusters of actors that work on these different areas are not yet well connected enough. So there is work happening in each of these clusters, but there isn't yet a sort of policy coherence and a togetherness that says, okay, this is how all of it comes together to help achieve that goal. So to me, I feel like there's a great sense of recognition that diverse diets are really important, that that plate must look sort of a certain way, with a focus on diversity, every day, all through our lives. And there is certainly recognition that actions are needed in all of these, but it hasn't yet sort of really come together tightly. But I think we're close. I think we can be very, very close in a context like India because so much has already happened in all of these spaces. So I want to, close again by saying that I think we need to be very, very, very clear about the goal here, and to think about and to know sort of how all of these systems are enabling reaching that particular goal. What's very clear from the remarks that Francesco shared, that Howdy shared, Sufia, Rahul, all of you, is that each of these systems has a role to play, and I don't think we can sort of play the systems against each other. I don't think we would serve the goals very well. And for me, our goal is very simple. It is that there are certain all people should be consuming diverse diets. How you achieve that will have to be worked out systematically. And I don't think that kind of analysis has been done fully yet, but we're close, we're getting there. So let me stop there, and we can come back to some of the other questions that you had shared with us in the Q&A session. Thanks.
Thank you very much indeed to all of the panel. Really great to hear your thoughts, and you all managed to pack a huge amount of ideas into just the short 5-minute stretches that you were given. So thank you very much for doing that. I can't possibly recap all of them, but just to pick out one or two from each speaker, and starting with the last one with Purnima, I thought this idea of real clarity on what the goals are that we're trying to achieve helps a lot as you address these difficult tensions between the different approaches. And using that clarity to develop policy coherence and a sense of togetherness in the different actors. I thought that echoed very much of what Francesco was saying, who talked about a whole range of different kinds of sectoral approaches, but very usefully brought us back to particularly emphasizing the need to reach the vulnerable, because it's far easier for many of these kinds of interventions to start off reaching those who are more easily accessible, perhaps in urban populations, as he mentioned. And the real challenge as we bring these two dialogue debates together is to make sure that we do reach the most vulnerable. Two of our speakers talked very much about getting it right as we think about what works. And that means both being able to celebrate the successes that we learn about, and also, as Sophia said, be brave about calling out the failures as well. We can't focus on what works unless we're willing to talk about what hasn't worked as well. Very important point. Rahul also mentioned this idea of a tiered approach, whereby you use different kinds of interventions to focus on either a base kind of problem that affects almost everybody, or a different set of interventions that might be more appropriate for those at particularly high risk. And Howdy brought us back to some of the dichotomy that he raised between indirect and direct approaches, with the indirect approaches not requiring such a in-your-face requirement for nutrition education or behavior change, but using more subtle prompts, if you like, around affordability and price, which he mentioned many times, again echoing that need to reach the most vulnerable. So that's just a few of the thoughts that were thrown out by our speakers over the last half hour. We enjoyed those very much. And now we're going to spend the next half hour on a few focused questions on some of the details. And I'd like to start with Francesco. Francesco, the food system context is changing incredibly rapidly. You know, every time we look, people are eating differently from the way they were a few years ago. Nothing stands still. How does an organization like WHO going about updating guidance on nutrition-specific actions to ensure that they remain relevant as these dietary patterns do continue to change?
Yeah, thanks, Saul, for the question. I mean, first of all, I'd like to say that WHO has taken a different approach to guideline development. So first of all, we're now considering that guidelines need to be continuously updated. So you don't have something which is then sitting there for 10 years without being reconsidered. It's living guidelines. Then we're not only looking at direct nutrition interventions, but we're looking at different kinds of intervention, including the policy one. And that's a very challenging one, because when you look at the effectiveness of intervention, you need to look at different experiences. You can't use the randomized control trials. You need to look more at the experiences. You need to look more at the observational work, and there's actually quite a lot going on there. We welcome the creativity of governments, of other actors in developing new approaches, and in the food system we're seeing a lot of that. So the other good thing is to look at these different ways, different kinds of guidelines, but also looking at the good practices, and bringing together those who are implementing good practices in collaboration, in coalitions. We're very much in the context of the Decade of Action in Nutrition, in promoting what we call the action networks. And we've seen this is extremely valuable as a way to cross-fertilize the experience between countries, exchanging the good practices and having the ambition in the idea of scaling up. So it's a much more flexible approach, and I think this is actually producing very interesting results, because we see that some of the policy approaches, for example, fiscal policies, now we have 73 countries in the world who have taken up the recommendation of doing fiscal policies, and we are learning from them on how to implement them and what is their effectiveness.
Super, thank you. Really tremendous to hear WHO embrace this whole range of different approaches, including going as far as fiscal policies and along with all of the more nutrition-specific interventions you mentioned earlier. Fantastic. Sufia, your organization has been very strong historically on nutrition-specific actions. So how are you thinking about rebalancing your portfolio, if you are thinking about that, to include food systems transformation? And what trade-offs, if any, might this lead to in your funding?
Thank you, Sol. And that's a very, very important question. And we have been thinking about it. And we do realize that, any trade-offs have to be guided by evidence and decision sciences. And, as I was saying, that we have learned that the work on food systems needs to be done. It's not a choice, right? Because we do realize that that is important for nutrition. However, we also realize that we are on a very steep learning curve on what does that mean? What are the problems? What are the solutions? What is the local data we need? What are the local solutions that we need to have? And I think we are also investing in understanding some of these evidence base. We are working with smallholder farmers in Africa to look at climate smart nutrition in India. So I think there's a lot of evidence generation that needs to happen. And I think once we have the evidence, then only we know whether there will be trade-offs or the work on the food system will have a force multiplier effect on the work that we are doing in the nutrition sensitive space. However, I can assure that, for us, there is some unfinished agenda like maternal nutrition and child wasting, and we will continue to focus on those.
Thank you. And since you focus very much on evidence and decision sciences, I'm going to go to Rahul next and ask, here's a difficult question. If you could prioritize just 3 variables to monitor across the world in near real time to keep nutrition programming relevant in the way that Sufia has just been suggesting, what might they be?
Yeah, not a easy question for sure, but I guess building off clarity around knowing what works and then thinking about delivering them, I would focus almost entirely on variables along the coverage cascade. So there's been a lot of work done recently, and actually goes back to the 70s with the Tanahashi framework, but that thinks about how interventions are delivered and maps out the steps in that process to a change in the desired outcome. And I think for all the interventions that we're thinking about scaling up, if we can do that mapping and collect data to think about service contact coverage or quality adjusted coverage or outcome adjusted coverage, and make sure we're collecting data at the level that's consistent with decision making that can be used, I think we'll make tremendous advances in understanding how we're delivering interventions and where the gaps are. So honestly, all 3 variables I would pick would derive from that coverage cascade. And I know with it's much more clearer in the health system, but I've seen, for example, GAIN has developed this for large-scale food fortification, map that cascade out. And I think that's an example of how you can really pick variables across that's super informative for decision-making. So that's where I'd go.
Great, thank you for that very clear direction as to what we should be focusing on. I'm going to stay a little bit with the evidence-based theme and go to Howdy and ask you, what could agricultural research do better to help inform the design of efficient nutrition programming?
Well, I think that the most important thing is probably just in the breeding that's done, the plant breeding that's done in agricultural research. We really need to understand the minerals and the vitamins and other compounds that come out of the new varieties being developed. Back in 1993, when I was talking to scientists about whether plant breeding strategy could work, my first appointment was with Gurdev Kush at the International Rice Research Institute here in Los Baños, Philippines. And he'd won the World Food Prize for the development of the high-yielding varieties of rice. And I asked him about breeding for iron in rice. And he said, oh, nobody's ever asked me about how much iron is in rice before. And he stood up and he looked for a book on a shelf to see if he could find out how much iron was in rice. When you go to the food composition tables in the Philippines and all the dietary surveys that are undertaken, and you look at iron intake by food group, milled rice provides 30% of iron intakes in the Philippines. Milled rice provides 40% of zinc intakes in the Philippines. Those intakes are not adequate, but what they do get, they get high percentages from rice. And yet all the plant breeding had focused on yields and hadn't paid attention to the nutritional quality of what was coming out. And it turned out when you look into it, actually the densities had been going down over time. So I think that's one of the main things we can do in agricultural research is pay attention.
Brilliant, thank you. Now, turning a little bit back to the core theme of the potential trade-offs. Purnima, I wanted to ask you, for a long time, the policy environment in India was perhaps more sympathetic to food-based approaches than to nutrition-specific actions. And it seems that has evolved quite a bit over recent years. And I wonder if we should now view India as a really good example of a balanced approach.
Well, I think India right now is a very good example of a portfolio of approaches happening in different sectors. So it's an amazing time to work on nutrition here because you have a very strong recognition of the importance of nutrition in and among people working in the health system, working within community-based nutrition programs, of course, within within several different actors among the food system. Actually, as I mentioned, there's people working in agriculture, the community working on fortification. So it is really a total portfolio of approaches. Right now, it's very promising for those of us who are, have been wanting all of these different systems in a sense to pay attention and to value nutrition and to value the integration of nutrition into their system, their health or social safety nets. But I really struggle at this point because I think we still don't know how that is coming together. There have been significant data challenges. We actually don't know how all of these different systems sort of come together and coalesce, especially around vulnerable populations. There haven't been sort of consumption and dietary surveys for a while. So it feels promising and exciting and interesting in the context of integration and appreciation and, like I said, a whole valuing of nutrition within these different systems. But it needs to come together in a more integrated fashion. We definitely need more information on how all of that is playing out, particularly in a context like this. We've been affected. The pandemic, of course, has affected the whole world, but there needs to be quite a lot more data coming through on what's happening with diets, how are these reaching vulnerable populations, and what then should happen to sort of tinker within each of these systems to make sure that we can really influence what comes onto the plates of people. That goal.
Great, thank you. Francesca, so Purnima just mentioned there this idea, this concern that many of us have in our minds of trying to understand how it all comes together. And I think as we go into 2021, many people in the nutrition and food world have that big question about the big events that are coming up during the course of this year. We have the UN Food Systems Summit, and of course we have at the end of the year the Nutrition for Growth event, completing a decade of interest there. And there's still perhaps in some people's mind a lack of complete clarity about how these two events will come together. And I wonder how you see them. Are they going to showcase faults between two different communities, or can they really be made mutually reinforcing?
Yeah, I agree, and I think we need to be very frank here. Let's talk about the positive side. I mean, both call for commitments, and both call for high-level engagement. Both call for multi-stakeholder, large community, bottom-up. So there are, of course, some common elements and some common energies behind these two areas. But it's true that for the Food System Summit, although the scope would be health, environment, and the economics, in reality, health doesn't seem to be built in as a major element. It seems to be a little bit of an afterthought. So we believe that we need to actually build better this health narrative in the UN Food System Summit. And I will actually use the 5 pathways that the beautiful report of IPES Food has given us. So first of all, unhealthy diet and malnutrition. And altogether, unhealthy diet and malnutrition account for 20% of the global burden of disease, 20%. But then there's a second pathway, the pathway of food insecurity. And we've seen how this is actually a challenge. In 2030, we're going to see an increase in the number of malnourished, even in the best scenarios of the economic crisis, 870 more million people in 2030. And the third one is food safety. Food safety still affects 1 in 10 people every year. Fourth is the health of food workers. And fifth is the environmental contamination, looking at use of antimicrobials in food production, looking at zoonosis, which, by the way, is at the heart of the current crisis. We need to avoid this to rehappen. Pesticide residues. So all those elements will need to come in the Food System Summit. Vice versa, Nutrition for Growth can contribute to stress the health angle in nutrition, so that all the direct nutrition intervention is something that comes very strong in the Nutrition for Growth, with its appeal to universal health coverage. But that Nutrition for Growth will have to somehow reflect the kind of food system approaches and commitment that will be developed in the Food System Summit. So there's work to do to align them, but I believe we have all the possibility to do so.
It's really helpful, thank you. Helps us be more confident that we can join up these 2 big events. And of course, there's a third big event next year as well. There's the next round of the climate discussions happening in Edinburgh. So Soufia, your organization has also been a very big champion of action on climate change. And so what would it actually be at the heart of an agenda that would foster climate-friendly food systems change whilst also advancing good nutrition? Can we manage to bring together these 3 different approach topic areas?
Yeah, and again, Saul, this is such a good question, and this is something which we as a foundation have been kind of reflecting. And as you know that for us, both nutrition and climate change is core to our work. And that is partly because we are a philanthropy dedicated for children. And we believe that, both these issues are very critical to what we see as a future fit for children. So there are some shifts that we are making as an organization in both on what we do and how we do business. So on the what we do, in the past, we used to have a climate strategy and a nutrition strategy. And those were kind of siloed approach. This is no longer the way we will do business. So we are now looking at more kind of integrated strategy. So just to give you an example, our board recently approved a land use and food system strategy. This is the first time the 2 have kind of come together in the form of an integrated strategy. The second, if I could mention in terms of the how of doing business, there are 2 principles that we are applying. One is what we say localization, right? The problems are local. The solutions have to be context specific, and generating that knowledge and solving those problems locally with the local knowledge is something which we'll do as an underlying principle. The second, I think, is what I mentioned, having an equity and gender focused lens to all our programming. And I think that's the way we are trying to approach in terms of the new way of doing business, bringing the two aspects together.
It's really great and very concrete examples of how to bring two worlds together and try and make that a real concrete set of actions for a specific organization. Howdy, sort of a similar question. For many decades, you've been a goodwill ambassador, as it were, between the agriculture and the nutrition communities. Do you see any evidence that these two communities are beginning to plan together for better nutrition outcomes? Or are we still a long way apart? And you might like to relate this to the earlier question about the big events during the course of the year.
Well, it's, I guess I have a lot more experience on the agricultural side and trying to convince agricultural policymakers to pay attention to nutrition. Once I was visiting India, and Ashok Gulati, who was the head of the Price Commission, he was going up to address agricultural policymakers at a government retreat in Mussoorie. It's kind of they were from different states in India, and they were going through kind of a mid-career training. And he said, "Why don't you come up with me and talk to them about nutrition?" So here was a group of agricultural policymakers who've been working in agriculture for 20, 30 years, and this was probably their first talk about nutrition. So how could I get? I was trying to think how I could get their attention. So before I started talking, I asked them to raise their hands. I said, "What's more important to you, your health or your income?" And everybody, of course, raised their hand. "My health is more important than my income." I said, "Fine." And then I went into my spiel and I explained how agriculture affected the prices and the incomes and their diets and health. And I knew that when they made their decisions, when they went back to their jobs, they were always looking, how do I improve productivity? How do I improve farmer incomes? So I said, now when you go back to your jobs, are you going to worry about income and productivity, or are you going to worry about nutrition and health? What's going to be your priority? And of course, they all said it's going to be income and productivity and not nutrition and health. So you can't, it's a pretty steep hill to climb. But last month on World Food Day, the Prime Minister of India, it was 75th anniversary of Food and Agriculture Organization. And the Prime Minister made a speech and he dedicated a 75 rupee coin, and he dedicated 18 biofortified crops and said we need to, and he went on at some length and said we need to use these biofortified crops in our food subsidy system. So, you make progress and things happen. So yes, I do see lots of things happening that I didn't see even 10 years ago.
Wonderful. That gives us all cause for hope. Thank you very much indeed. Rahul, turning to you, and I just want to build a little bit on what Howdy was just saying there. He gave us a very nice example of this kind of the complexity of the interrelationships between all of these different variables that you have, from agricultural production through to prices, through to income, through to health, and right back again into productivity again. So this is a kind of a classic example of a complex system with feedback loops. And many of our analytic approaches struggle a bit to deal with this kind of complex systems problem. So do you, from your perspective, looking at the advances in analytics in our area, do you think that the current analytic approaches are up to the challenge of disentangling all of these relationships and feedback loops?
I don't want to sound like an Eeyore about this, but frankly, I think we're falling short in terms of the analytic tools that we currently have and their ability to deal with this complex system. Frankly, we have limitations across multiple parts of the value chain. We have oftentimes bad input data. When we think about dietary intake or micronutrient status data, I mean, it truly is quite bad. We have then sort of this problem where we're not able to factor in data from different sectors. So there's a sort of analytical step that we have limitations around as well. And so I do think this is an area that needs investment it's not going to happen organically. So, and I know that there are several donors that are interested in trying to do this. But I would want to caution that we can't let the perfect be the enemy of the good here. I think we tend to try to develop models and reduce error in them, but ultimately it's a messy process, some of this decision making and policy making. So short answer is no, we need to do more, but let's right size it so that we're not being too academic about this process.
Fantastic, thank you. And finally to Purnima again, and one of the elements of the complexity in the Indian situation is, of course, there's so many different levels of governance in India between the federal and the state and the district and the village, and all have their relevant authorities with particular responsibilities and roles assigned to them. So what are your thoughts? Is the best scale for trying to pilot some of the integrated approaches that we've been discussing over the last hour, and to try and understand better the impact and cost of different ways of tackling nutrition?
No easy questions here, but let me go back to this idea that what reaches people or reaches people's plates is coming from many different sources, and some of those sources are publicly administered programs. Majority of what comes onto people's plates and goes into diets is actually coming from the private markets, etc. So in the context of a country like India, I mean, to pilot approaches that make sense in terms of being relevant to people in other administrative units or potentially replicable, I think the district is a very good unit for things that are within reach of administrators, government administrators, because the district is a very important administrative unit in the context of India. So if what you're trying to do is through the implementation or bringing together things in the context of implementation of programs, the district could be a good unit to pilot approaches. However, if the idea is to change what happens or to approach this integration in a way that reshapes or shapes what's on people's plates, I think where there are things that happen even within some of those programs where the administration around implementation is primarily sort of addressable at the district level, anything that requires a policy shift or anything within parts of the food system that are affected by either national or state policies. So for example, this could be anything related to minimum support prices for farmers. This has a big impact in terms of what shows up and how much things cost. Codification legislation, what kinds of decisions about what kinds of things go into those publicly administered programs where, the district is a useful implementation unit. So I think it's hard to kind of pin down just one level. But again, I think if we are clear about, is the transformation that you're looking to achieve through bringing things together from a public administration perspective, the district in India would be both a unit at which you can implement and innovate, but also a unit that speaks to other people. There are 700 odd districts in India, 700 administrators who are constantly looking for success cases and lessons from things that have worked in other areas. And we haven't done enough work on understanding, some of the success cases, for example, we've done it in several states in India now. And that's useful, but that's only useful for state administrators. It doesn't really work when people in districts are looking for examples of.
Thank you very much indeed. Well, thank you all of you for those great answers to a series of questions here within our panel. We're now going to go to the final part of our session, and we have a very engaged audience. We've had 22 questions so far, wanting to hear from all of you. And so I'm going to pick a few of those and turn them over for discussion. And I think the first one is for Francesco, I believe. Pat is asking us, are there any plans for the Essential Nutrition Actions to be an explicit part of the Food Systems Summit?
Well, the short answer is not for the moment. The Food Systems Summit is not really looking at the health sector, the delivery of direct intervention in the health sector. So we will have to build that. We were looking more at the Nutrition for Growth Summit as the avenue really to mainstream the essential nutrition actions. I can see that, as you know, the Food Systems Summit has 5 action tracks. And the one that WHO is involved in is really about shifting dietary patterns. So would the health sector have a role in shifting dietary patterns? So perhaps that could be the entry point on bringing the health sector and also making sure that some of the essential nutrition actions are profiled there. I mean, one important key one would be the dietary counseling element. The dietary counseling is part of the essential nutrition action, so we can definitely make a case there. But I must say, to be frank with you, it's a bit of an upstream, we have to go uphill to make this happen.
Great. That won't stop us, though. We're all good, experienced at working uphill sometimes. The next one, I think, is for Rahul, and it's a question from Saskia, and she's asking about tools that can capture cost effectiveness of both health and food system interventions. And she notes that we first need to have data on both costs as well as on effectiveness of nutrition outcomes for food systems and other nutrition sensitive interventions. And of course, collecting these data, especially on nutrition sensitive interventions, such as, for example, cash transfers, can be quite difficult. They're varied and they target many outcomes outside of nutrition as well. So her question is, how can we avoid spending years and years collecting these data before we can actually move forward with the agenda?
That's a good question. First, let me say that I think there are some existing tools that look at cost effectiveness of both food systems and health system interventions. And I mentioned Minimod, for example, that's able to optimize different interventions to address micronutrient deficiencies using both cost data, effects, and effect data, effect size data. So I think we need to build that some more. I've spoken to many modelers who say, we can model, they can model their way out of a paper bag, right? I mean, but we are limited by evidence around what goes into those models. So how do we address this challenge of not waiting for perfect data? I think Francesco touched on this earlier, where maybe not all data has to be from randomized control trials that goes into these models. I think we need to allow for evidence that isn't quite at that level to be in there. But it would be a fool's errand to say that we don't need to strengthen what goes into the models to be able to get useful output. So I think we need to just think carefully about data that's available maybe from less rigorous studies that can be put into these models.
Thank you very much indeed. The next question is for Panima. Katerina asks us, how is the government in India, I guess, facilitating the collaboration and dialogue that's needed to connect different government organizations which have generally worked in their own pillars, areas, siloed areas of agriculture, food, or health?
So 2017 is when sort of the last comprehensive nutrition strategy was developed, and since the launch of the new National Nutrition Mission in 2018, a lot of the dot connecting and coordination work has been around implementation. Now, much of that is coordinated by the Ministry for Women and Child Development, but that's been primarily around undernutrition side of the agenda. So in terms of the work that happens on the other aspects, the other things that I think about, around fortification, around Food Safety and Standards Authority and their work on healthy diets, etc. That isn't, that's sort of happening on its own steam. So, as I mentioned earlier, I think there is a real need at this point in time for a review of the coordination structures for nutrition in the context of India's nutrition mission. There is, there is the National Policy Think Tank, Niti Aayog, which does, I guess I would call it a lot more strategic reviews and sort of dot connecting around different areas of nutrition. And there are people in the Niti Aayog who work both on health and on agriculture and all of that. But it's still it's a strategic policy think tank. It isn't sort of a coordination mechanism that comes with authority structures and sort of another set of convening skills or convening mandates that one might need to kind of nail things down. But there are, between the Niti Aayog and the Ministry of Women and Child Development, there's a fair degree of coordination-related work happening, and the Ministry of Women and Child Development, what's been nice to see is that there has been a lot more outreach, for example, to Ministry of Agriculture, in terms of connecting some initiatives in. But I think what we know from studying coordination and collaboration in nutrition is that you always need, if you want a comprehensive plan that truly connects different departments in industry that are laterally sort of equal to each other, you need higher level coordination structures to catalyze. And that, I think, it's still a little bit, it's a little loose right now. So let me leave it at that.
Great, thank you. Have a question that perhaps Howdy would like to start with at least. This is from Heike. Could you speak to the relevance and contribution of reducing food waste and preserving nutrients along the food supply chain? What are the key investments, as you see it, required to prevent quantitative and qualitative food waste from occurring?
Okay, somebody else may want to answer that question. It's not really an area of expertise that I have. I do know that basically the food staples, they store well. You don't have as much food waste. Food waste tends to be a problem with the fruits and vegetables where you need refrigeration, etc. And the waste occurs is because the steps and the investments that you have to take to preserve the foods tend to be very expensive. And so is the value of the food that's wasted more valuable than what it costs to save it in terms of, say, providing refrigeration or whatever, better roads so that the produce get to the market more quickly. So you just have to look at what investments need to be made to make sure the produce gets to the market more quickly and under less stress, so to speak.
Anybody else like to jump in on that one? Francesca, please.
I'd like to comment perhaps on one element. As you know, food waste has different components. One is closer to the producer, and then it's a supply chain issue. The other one is closer to the consumer. And we do have quite a lot of waste, for example, due to misuse of the expiry dates. And here I think there's an interesting discussion going on about making a difference between best by and use by dates. I mean, of course, we want to keep the food safe. So those expiry dates are intended to protect consumers from eating food which has gone off. But and of course, that's the important element. But we should avoid that, simply a slight change in organoleptic properties is a reason for discarding valuable food. So I think that is an important, piece of work that needs to be done. And then there's the other issue of how to, for example, connect the potential, use of foods which is close to expiry date to social protection system. So how can we, put that in play again? And I think there are a number of interesting experiences for this to happen. So on the one hand, yes, we have to protect the food and avoid that the quality is lost throughout the chain, but at the same time, we need to avoid, particularly in a situation where keeping the nutrients in the food system is important. We need to avoid, overdoing it, and have adequate ways to make that assessment.
And I think we've had very impressive publications, particularly from FAO over the last year or so, really delving into the question of food loss and waste. And I think while everybody's clear that it's a challenge which desperately needs to be addressed, it hasn't been so clear what the solutions might be. And certainly from us in GAIN, we've recently been really excited looking at some results that we've had in Nigeria, where we've studied the cost effectiveness of some very simple interventions, such as cold rooms on farm or cold trucks, or even something as simple as using plastic crates to move fruit and vegetables around so that they don't get destroyed so easily while bumping along the rural roads. And have some really clear examples of very strong cost effectiveness, even from the perspective of the farmers or producers or transporters themselves who might be wanting to make that investment. So I think that gives us a great reason to hope that we might be able to move that forward. Okay, moving on to, excuse me, sorry, another questions. I think this one may be for Sufia. Shelley asks, what can we learn from best practices and successes or failures in other countries with more developed and advanced food systems? How can we apply these exemplars to other countries?
First of all, Saul, I would like to say that, I wish there were some good examples coming out from the more developed countries as well, because, there's, I would say it's a different kind of a problem when we look at countries like in the UK compared to if you look at, the problems which we are facing in Africa. And I think it's a very different kind of a problem. And when we are looking at, from a lens of both climate as well as nutrition, and I'm pretty sure some of us have read this Lancet paper that came out on Future Fit for Children. Some of these developed countries are doing very well when it comes to things like improved mortality among children and others. But when you look at the consumption pattern and the food and the climate change, we are doing really bad. So the UK, as for example, if you would see that there are a lot of problems that we have when it look at, from a climate perspective. So I would say that, there are kind of some good learnings coming from everywhere. So like we work very closely with a farmers network, which is called One Acre Fund in Africa. And, they work with almost like 80% of the smallholder farmers. They live in 8 of the African countries, and they are working very closely with them to look at local solutions. What is the way to incentivize farmers to produce more nutritious crops, because they may not be the most lucrative when it comes to the markets, right? So what are the various ways to incentivize farmers to produce the better crops? And then, what are the policies that we should look at in terms of improving the food system? So when, one of the areas, maybe if I could mention where I say UK as a good example is, UK is perhaps the only country which has mandated fortification of bread with calcium. So, there are some good examples which are there in countries like the UK and the developed countries, but I also think that there are a lot of good examples which are coming from countries like Africa, Bangladesh, and India. I mean, we heard Purnima also, we heard from her in terms of the policy environment, how they are really taking it in a forward direction. So I think what is needed, Saul, and this is what I mentioned when I said the evidence base, what is needed is a collection of this best practices and to understand what is the direction that we want to take this forward.
Great, thank you. The next one is for everybody, probably. It's a comment and question from Augustin, who says, at the core of these difficult food systems policy choices, and how much to focus on nutrition outcomes or not, are trade-offs for policymakers between different sectors, between different stakeholders, and vested interests which are very difficult to navigate. He says he's curious about the insights of the different panelists on best practices or success stories in navigating these trade-offs. With a focus on the process, how do the policymakers navigate the trade-offs rather than the outcome? Maybe we'll go back to Francesco to start. Would you like to kick us off?
I think Howdy is in all.
Howdy, yes, you look like, sorry, I didn't see you waving. Please, Howdy, jump in.
I think you can get really paralyzed by looking at the complexity of things. This kind of gets back to what Rahul was saying before. I think if you say you want to improve dietary quality, I think you should start with a specific food. You should say, oh, if the poor people in our country could only eat more of this specific food, that would really benefit nutrition in our country. Then you focus on how do I get the price of that food down? And then you come up to certain blockades for that particular food, and you solve your different constraints and blocks, and you do the different things that it takes. And it may take you a decade to solve the problem, increase the supply, and lower the price. And I think that's how you make things happen. You don't look at the whole system and you fret over this and that, and where's the best way to intervene? Should I intervene over here? Should I do A? Should I do B? Should I do C? No, pick the thing that you want to intervene with. Pick the food that you want to increase the consumption of, and say what does it take to get increased consumption of that specific food, and then go for it.
Thank you for that. Yeah, that's certainly resonates with many discussions that we've had internally, and I'm sure many other organizations have that. To what extent to focus on a specific food, or is it the whole diet rather than individual foods, or is it interventions that can cut across many foods? And you made an impassioned plea to start with the foods, which I'm sure many will relate to. Who else would like to take a aspect of this question?
Since you called me in, so no, I do agree that we need, and I think we've already said before, we need to understand what the objective is. And here, if the objective is actually reduce malnutrition, if the objective is to make healthy diet affordable to those 3 billion people who have been left out, well, then I think the priorities should change. Yeah, food trade-off is, of course, is an important concept, because we need to ensure sustainability in many ways. We need to ensure environmental sustainability. We need to ensure economic sustainability. But at the moment, it seems that the health objective is a bit the last one to consider. I think we need to reverse that pattern. So food shouldn't be considered as a commodity on which to organize an economy. Food is something that needs to is needed to really address population nutritional needs. One interesting way to modify that perception or that analysis is to use what is called the true cost accounting. So basically, each food has a cost, which is not only what is paid directly by the consumers, but it's paid indirectly by the society. And for example, a lot of the foods that have an impact on non-communicable diseases have a lot of hidden costs. Now, having a complete understanding of those costs would also lead the policymakers to reconsider the policy choices. So I think that kind of new metrics might help really better shape those trade-offs.
Very much. Nima, you wanted to come in.
Yeah, I just wanted to say that I think that's a really, really important question that Augustine has asked, but I don't think we have the answers to the how. I think you see the results of how people have worked through trade-offs or balancing choices or investments. You see the results of that in, for example, annual budgets. You see that in what's emphasized in nutrition strategy documents and things like that. But to actually understand what happened in the context of those, those decisions, I think that's an area for political scientists and nutritionists to be working together. And we still don't have enough people really examining those things. I mean, I can probably literally count on one hand, maybe the kind of people who really study politics and choice making in the areas of nutrition and who write thoughtfully about those things. So to me, this is just a huge area of knowledge. And we have case studies. I think the extent to which countries may have emphasized treatment of SAM versus preventive programs for child nutrition, I think that offers a tremendous case study in, at least some kinds of trade-offs that people in decision-making spaces or in, financing of nutrition have made. And those trade-offs or choices have been made not just by governments, but they have been made by funding agencies for nutrition. And there's a lot that can be learned, I think, by asking, about the choice making within there. My guess is a lot of those, similar choices end up being made by governments as well. So I just want to call this out as a really important question, one where I just don't think there's enough work to understand that it's been done. So,
thank you. Okay, we'll go to Rahul now. We have a question from Saskia, different Saskia. She says, great point on the need for a package of actions that address underlying causes. That requires a context-specific situation analysis that unpacks the food system and food environment, as opportunities are different across contexts. How about starting to pull together learnings that pertain to specific food systems typologies, maybe using the kind of approach that the Food System Dashboard has done, including going beyond a national classification to a subnational level? Rahul.
Yeah, no, Saskia, I totally agree. I mean, I don't think there's much for me to say other than I agree with that approach. I think we do need to have sort of multiple sort of case studies or examples of this, and let's talk. I think that's definitely something that's needed.
Great, thank you. And now getting to the last questions. Sophia, here's a difficult one for you, but it probably goes back to this intersection between climate and food. And Jean asks us, how can food systems foster resiliency in a population?
I think that's a very good question, and I would rather take it as a comment because, this is what we have been talking. When you look at climate and you look at food systems, what we are really trying to build is resilient communities. And I think that is very important that we really look at it from that kind of a perspective. So just to give you an example, we were recently making a strategy for Africa, for our Africa portfolio. And we were really thinking of, how do you bring things like making sure that the children are born healthy, making sure that the environments are safe, that, there's less, worms and NTDs are protected. And then we finally, when we started really thinking of the intersection, how do they intersect with each other? And especially when it comes to the level of the children, we realize that it is all about resilient communities, right? So I think that it is rather less of a question, but rather a comment. And I think that is a very important kind of takeaway for us, that when you bring these things together, you are actually making communities more resilient, and you're making these food systems more sustainable for the long run.
Thank you. Howdy, you wanted to come in on this?
There's quite a bit that plant breeding can contribute in terms of climate change. You breed crops that are drought tolerant, that are heat tolerant, that are submergence tolerant, where there's a lot of floods. So it's a very powerful lever to deal with climate change.
Great, thank you very much. I think that draws together all of the various themes that we have been talking about today. That final note about resiliency gives us that real long-term perspective as we think about not just how to marry the interests of one particular discipline or set of stakeholders with another, but also how to balance those tensions between short-term actions and ones that are much longer. So with that, I would like to offer a big thanks to our wonderful panelists. They've shared huge range of insights with us over the course of today and have lived up to the challenge of trying to answer questions coming in from the audience that, of course, they didn't have a chance to prepare for, and give us some really great food for thought on those ones. Thank you also to our audience. It's been wonderful having you with us today. Thank you for feeding us with those highly stimulating comments and questions for all of us, feeding off the discussion that we started with. I'll give you back 2 minutes of your day so that you can prepare for whatever next session that you're planning to go to in the course of this conference. And I very much hope that we'll all have a chance next time to meet in person. It's been nice doing this virtually, but it would be so much nicer to be all together sharing some nutritious food together. Thank you, everybody. Have a good day. Have a good evening, those of you who are already well advanced in tonight, and best of luck.
Goodbye. Thank you.
Thank you.